Edition of kidney health class, and we are going to be. Hello, are you there? Okay. Today we'll be looking at kidney stones. We'll be looking at kidney stone surgery versus kidney um, versus water therapy. So we'll be looking at water therapy versus kidney stones. Okay, a lot of persons have started their kidney health, their kidney stone treatment journey without being able to say this is what it is or this is not what it is when it comes to the terms of their treatment. Some people have gone to the hospital to receive treatment for kidney stones, and they are told that they should keep drinking water, and they keep drinking water with the hope that something is going to happen, and nothing happens. Okay, so in this very section of our conversation today, we want to be talking about when is the right time to actually drink water, and when is the right time to actually seek for surgical treatment. So apart from surgical treatment, apart from drinking water, we have other treatment options available for those who have kidney stones. And one of them is the normal taking of drugs and all the rest of them that we've always talked about. Okay, but before we go into what we have for today fully, I would um, I would like to also take one or two questions from here. I saw some of the questions that some of us dropped in the group. Okay, I'll be answering the questions. I'll be answering one or two questions from there in this live video, and I will also be answering um, I'll also be addressing those questions in the group. So if you're watching this video and you're not yet in any of our group, I want you to indicate by telling me that I'm not yet in the group, so that you'll be added in the group. Okay, we have a group on WhatsApp. Okay, we have a group on Facebook. We also have a group on Telegram. Okay, the Telegram group is actually our backup group. Okay, because we've had several attacks on our WhatsApp. So our safest place for conversations is our um, Telegram. So you are in the if you are in our WhatsApp group, you can also as well indicate, so you'll be added to our Telegram community where we'll have more secured conversation. So now let's go into the business of today. We'll be looking at we'll be taking two questions from this book, like I said. So this book is titled The Kidney Stone Handbook: 100 Essential Questions and Answers. Meaning to say there are other important questions. There are other important questions about our health, but we'll be taking 100 essential questions and answers. But we'll be looking at few questions. I didn't plan taking anyone, so it's just going to be anyone I open that picks my attention. So we'll now be treating it. So we'll be taking question number 71 and question number 72. Okay, we're going to be taking question number 1 and question number 72. Okay, so I want you to pay unwrapped attention. So if you have your book, you can bring it out so that you'll be following. So question number 71 says, if I have kidney stones and kidney cysts, which one should I treat first? So if you have kidney stone and you have kidney cysts, the question is that which one should you treat first? If you have both kidney stone and kidney cysts, the treatment approach depends on several factors. So if you're having kidney stone and you have kidney cysts, both of them existing in one person, you have to consider several factors. But before we go on, I want to tell you that one of the causes of kidney stone is actually what we call polycystic kidney disease. So if you're a person and you're among the class of people that have polycystic kidney disease, it also means that you have a higher risk of developing um, kidney stone. Yeah. So now we look at the severity. So if you have kidney stone and kidney cyst, you have to look at which one of them is actually causing you more severe symptoms. If the pain you're having is coming more from cyst, that means you need to handle the cyst first. If it's coming more from kidney stones, it means you also need to handle kidney stone first. So how do you know the one that is actually giving you issues? Okay, so that is another question that you need to answer. Okay, so now kidney stone, and you need to know the kidney stone size and the location. So if is the kidney stone blocking the urinary tract and causing severe pain, so you need to also understand if the stone that you're actually having, if it is blocking the flow of the urine, if it's blocking your urinary pathway, and how large this stone is. So if you have a kidney stone that is actually very, very large and is blocking the flow of urine, it is also very important that you remove the stone first before addressing the cyst. It also, the cyst size and complexity and the location of the cyst too can also help you in determining the one that you treat first and the one that you, because we are trying to look at the one that you remove first and the one that you come back later to see how you can handle. So we also have kidney function. So are your kidney functions normal, or the underlying, are there any other underlying kidney disease? So these are the things that you need to find out. So the book said typically the treatment priority is given to the condition that is causing more severe symptoms or poses more immediate risk to kidney function. So this is it. So I think this book is actually very important for those who have kidney stone and even kidney cyst. So if you're finding it difficult, maybe making a decision on the test, um, on the treatment to start first, you have kidney stone, but you also have kidney cyst. You're finding it difficult. Which one should I go for first? Which one should I actually take on? So I think this book has actually helped you to let you know that you need to go for the more severe ones, the most one that is causing severe complications. So kidney stone treatment priority. If you have kidney stones, look at the priority. If you have severe pain, if you're experiencing severe pain from kidney stones, the treatment for the stone may take priority. So if the stone is also causing blockage, like we also said, if the kidney stone is blocking the urinary tract, treatment to relieve the blockage may be necessary to prevent kidney damage. So if the persistence of the stone, or the existence of the stone, is going to cause problems for your kidneys, maybe cause retardation in the kidney function, that means you need to consider removing the kidney stone first. Then infections too. If you have kidney stone and urinary tract infection, treating the infection may take what priority. So then we'll have kidney cyst priority too. So now we are done with the priority of kidney stones. So now you're looking at the priority of kidney cyst. It said large or complex cyst. If you have a large or complex kidney cyst, treatment for the cyst may take priority, especially if it is causing symptoms or poses risk of rupture, or even poses danger of cancer. So we have systematic cyst. If the kidney cyst is causing symptoms such as pain, hematuria, hematuria, that's blood in the urine, or fever, the treatment of the cyst may be necessary. So we also often tell people, if the cyst is not causing you any problem, that there's no need removing the cyst. But if the cyst poses danger to your health and to the functionality of the kidney, that means you need to do something to remove it. So we have now the one we call the coordinated care. So it's actually something that requires multidisciplinary treatment. It also requires individualized treatment and a whole lot of things written on how you can follow the treatment modalities. This is why I advise everybody following me, everybody watching my videos, everybody following what we are doing, every member of Kidney Hair Class, to get this book, because it's actually very rich in what we are discussing. So the next question number 72, says, can kidney cysts go away on their own without treatment? Some kidney cysts can resolve on their own without treatment, but it depends on the type and the size of the kidney cyst. Because we have simple kidney cyst. There's presence of one cyst. There's very small cysts. Presence of one cyst sometimes may be asymptomatic, and sometimes may also be problematic and mistaken for kidney stone, depending on the location. So we also have complex kidney cysts. There's larger cysts and symptomatic kidney cysts, and cysts that can actually be infected. We also have polycystic kidney disease, that's the PKD, and not the rest of them. So we also outlined the modalities for the treatment. And someone was asking me in the group, how much does it take to actually remove kidney stone, to perform kidney stone surgery? So in kidney stone surgery, we have the open surgery, and we have the the lesser lithotripsy, or the improved surgical approach to solving kidney stone problem. So if you're going for open surgery may be below 1 million naira in some areas in Nigeria, and it can be as cheap as 400,000 in some other areas. So then if you're going for PCNL or lesser lithotripsy, you may get kidney stone surgery as from between 2 million naira to 10 million naira. I think I've shared that article I wrote about it many times. Okay, so the best treatment option for kidney stone is the one that actually fits the severity of what you're having. So you can't say that this is a one-line thing. Okay, you can't say that this is a one-line thing. So it depends on the severity of what you're passing through. So today we'll be looking at water therapy versus kidney stones. So we have a lot of persons who had kidney stones. So let's talk about, because we're talking about kidney stone fully. So I want us to now take a look at what kidney stone is. Kidney stone is the presence of a hard mass in the kidney, which would have formed due to solidification of minerals or waste products in the kidneys. So we have things that can actually cause someone to have kidney stone. We have dehydration. We have consumption of certain supplements. We have waste products. We've talked about dehydration. We've talked about some disease condition. We talked about inactivity. We have a lot of things that can actually make someone develop kidney stones. Okay, so we have even drinking of sodas. A lot of persons drink sodas. So sodas is the one we know in Nigeria as minerals, even beers. Okay, so taking of some antidiuretics can actually predispose one to taking of diuretics, not antidiuretics, can actually make someone develop kidney stones. So having laid this foundation, is actually important for us to now look at the different types of kidney stones. In this video, in this YouTube channel, I've actually discussed about different types of kidney stones, and I've talked about it over and over again. But for emphasis sake, I'll just have to mention them. Then, if you need details about them, you can look through the video we did the live kidney health class we did last week, or in the previous months. I think you'll be able to find them. Okay, so now we have the struvite stone, we have the cystine stone, we have the calcium stone, and we have the uric acid stones. So this all these kidney stones, all these stones, they have the causative organism, they have the things that actually cause them, and different ways of handling them. That is why if you have kidney stone, it's actually very important that you meet someone who is very knowledgeable about kidney stone to help you manage this condition. So having said this, okay, we've talked about what kidney stone is and all the rest of them. So kidney stones, the size of kidney stones vary, and the shape also varies. So there's no stone that has two persons can have kidney stones, and they will have different sizes, and they will also have different shapes. Okay, so depending on the size and the distance, so that is how the treatment also differs. So we have a kind of kidney stone that we call the struvite stone. Sorry, that we call the staghorn stones. So these staghorn stones actually have a kind of horn, a horn-like stuff around them. So this horn-like stuff around them makes this thing. So they have the what we call the staghorn stones. Okay, so the staghorn stones, like I said before, has the shape of a horn. Okay, it can actually lead to very serious damage to the kidneys. So, and staghorn stones often arise from struvite stones. Okay, I think we also discussed that in details last week. So these are the types of stone we have. So by the time you're able to pick out that, look at what this person has, is going to actually help you in planning the treatment and actual treatment of this person. So if someone has a very tiny stone that is as small as a grain of sand, you can actually tell this person to drink water, and this person will be okay. Okay, generally, drinking water is an integral part of kidney stone management. So anyone that has kidney stone, that has gone to the hospital, has seen a doctor, that has seen a therapist, the therapist would have told the person to drink more water. So the more water you drink, the better your outcome of kidney stone becomes. And most people don't have that habit or attribute, or don't have that attitude of drinking a lot of water. Okay, they don't have that. They don't drink a lot of water, as routinely. So when they now develop kidney stones, you're not telling them to drink water. Some of them find it difficult maintaining the tempo. Okay, some of them will start very energetic. Some of them will start drinking water as is required, and as time goes on, they are unable to sustain the tempo. Okay, so when that happens, they decline, and you discover that the stones keep getting large. So I've seen a lot of persons who were told to drink water, and by the time they keep drinking water, day 1, day 2, day 3, and by the time they went back for test, it is either the stone multiplied or the size of the stone increased, or most of the time, both of them actually happens. So this is the thing. This actually happens when someone has kidney stones. Okay. So now, um, drinking water is not enough to flush out kidney stone, especially when the stone has grown past certain level. Okay, when the stone is up to 2 mm, is measurable with ultrasound scan. You know that this stone would need more serious management than just drinking a lot of water. Okay, drinking a lot of water can help if the stone is already outside the kidney, in the pelvis, in the ureters or in the bladder. It will be easier for these stones to actually come out. But when the stone is still intact in the calyces, or in the upper and the lower pole, or the intermediate pole, or you call it the middle pole, it will be actually very difficult for that stone to pass with just drinking water. And many stones, that is stem kidney stones, are located in these areas that I've just said. So some might actually be lucky to drink 1 or 2 bottles of water and the stone will come out. But more than 90% of the stones wouldn't be able to come out. They will be entangled in the kidneys, and you may need to do more pragmatic treatment in order to make it come out. So your doctor may actually prescribe some drugs for you when you have kidney stones. When they look at the size and the position of the stone, the doctor may place you on a drug known as tamsulosin, okay, or the Flomax of this, what would I call it, Flomax of this word, okay, or the Flomax as we all know. So when the doctor places the patient on a tamsulosin, what the tamsulosin does, this tamsulosin is mainly a medication used for the treatment of prostrate in male. So this tamsulosin has the ability to cause dilatation in the renal pelvis, cause dilatation in the urinary tract, and when this thing happens, it gives room for the stones to fall off. And with the water that this person has increased, it will help propel the stone, and as the what we call peristalsis, as the movement um, of the muscles of the ureter is being encouraged, the stone is being pulled out of the body, and fortunately, it will be flushed out. So, but this tamsulosin that we're talking about has a lot of other side effects, like causing weak erection, or call it erectile dysfunction, and not the rest of them. So, and now, if a woman is also having it, there's also a concern. Some doctors may not want to place a woman on tamsulosin, especially if the woman is actually within childbearing age, or a TTC mother, or someone who is hoping to conceive soon. So there is a lot of medical agreement and disagreement when it comes to the use of tamsulosin in managing patients with kidney stones. So we're actually praying that in the nearest future we will get something that everyone in the medical field will come to agree to be an accepted medication that will be better than tamsulosin in handling kidney stones. Okay, so in our own way, we worked with an Indian company to develop something that can actually help you dissolve and flush out kidney stone, and that is called the no stone capsule. Okay, we've used it for a number of times to help people to become free from kidney stones. So if you have kidney stones, you have foamy urine, you have issues along the urinary tract, no stone can actually help you. So if you need no stone, you can actually indicate in the comment section, or you can actually indicate in the group, so that we can talk more about how you can use no stone and how no stone can actually be beneficial to you. Then we have the use of surgeries for the treatment of kidney stone. In fact, there is a science that is in medicine there's an agreed you have an agreed size of stone that is operatable, and we have a size that is not operatable. Okay, so there's a size of stone will be no matter who you are, you're gonna advise you to go for surgery. Okay, there's a size the stone will be, especially if the size of the stone you're having is more than 10 mm. We may actually advise you to go for surgery. Okay, but then there are also some stones that are 8 mm, that the dimensions will make it difficult for this person to be able to pass kidney stones. So we advise that person, since you're having this, do this instead of that, do this instead of that. So that is why it's actually very important for us to have a consultation section, so that will actually help us to determine what you need, what works for you, and what you should do. So having said that, um, talked about how you can use nose to also talk about the surgery. Okay, so now we said that if we had for the surgeries, like when we started, we made mention of the surgery, that we have open surgery and we also have closed surgery, the one that doesn't involve opening the body. So we have laser lithotripsy, we have laparoscopy, we have shockwave lithotripsy, we have laser lithotripsy. So these are different approaches in managing kidney stones, and all of them depends on the size of the stone. So if you have a smaller stone, the smaller stone may benefit from laser lithotripsy, where you don't have a cut on your body at all. The doctor, the surgeon, urologist passes the camera through your urinary meatus, gains access into your kidneys, and they will be able to remove it. I think I shared a video of a surgical section, a laser lithotripsy section going on in one of the hospitals we are affiliated with. So if you have kidney stone and you feel you want to remove it surgically, we are affiliated with one or two hospitals. I think we are affiliated to a hospital in Jos. We are affiliated to a hospital in Port Harcourt. We are affiliated with a hospital in Omaha that can actually help you in handling these conditions. So for those in Lagos and in the West, Lutz can actually serve as a place of record. But most of us don't want to go to a government hospital. So if you're that kind of person, I recommend that you go to either Jos, go to Port Harcourt, go to Omaha. You get the surgery done, and it's very perfect for you. So if you want to know if you've made up your mind, because one is I wanting to go for to know that you need surgery, and another thing is to make up your mind. In fact, when I had fracture in my knee, okay, what they call tibioplateau fracture, you can Google it and know the extent of it. It's a very serious um, medical condition. Okay, it's a very serious fracture. So I couldn't walk, I couldn't do this. So I was told that the only solution for me to be able to walk again was to do surgery. So I looked at the pros and cons. It wasn't easy for me to actually agree, yes, that I'm going for surgery. In fact, it was during the period that I wrote this book, during the period when I was hospitalized for the surgery, and after the surgery, I was asked not to move around. So I have to bring out time to write this book. So that is why I'm actually talking to you, making you to know that you can actually benefit so much from what we are doing. So having said this, it's actually very important, if you're here, you've not gotten the book, that you get it. It's going to be of great help to you. It was written out of my passion to actually help people. I was like, let me use this period when I'm on bed to get something that can actually help people. And I'm glad that it has actually helped millions of people. So if you're here watching me, you've not gotten this book, this is the best time for you to get the book, so it can actually help you to know a lot of things about your health. So now, what are we saying? We said that we have laser lithotripsy, and I've told you how laser lithotripsy is done. And for those of us who are afraid, you don't want to do surgery, this one you're going to have a cut in your body. So the camera will be passed through you, and before you know it, it will be brought out. And in most hospitals, like the places I've just mentioned, you don't spend more than 4 days in the hospital. You'll be out, and you can go back to whatever you're doing before. So the only thing there is that you don't have to carry heavy things, and something will be placed in your kidney. That is called the stent. And that stent, it can stay in your body for a few weeks. Some surgeons will want it to be in your kidneys for just 4 weeks, while some will want it to be in your kidneys for just 3 weeks. And by so doing, you can be free. Okay. So so I'm running out of time. So that's it. So if you have any question, like I said, you can actually drop it in the comment section. You can drop it at the comment section, or just give me a minute. I'll be right back. So, you're going. Sorry. Okay, sorry, sir. No, just a few minutes. I'll be done. Okay, that is it about kidney stone surgeries. So it takes few days. It takes few days, you'll be fine, and you'll come out. Then you do surgeries. So for those who doesn't want to do surgery, okay, like we've had 10 stone not dissolved or melt, what as the case may be, and people who use our treatment plan became better. Okay, so we know that is not that we can't tell you to that we have a treatment that can take off 9 stones. Okay, so 10 stones. So we don't tell you that. So it's left for you to make up your mind that you want to give it a trial. So if it works for you, it's okay. If it doesn't work, you know that you fought a good fight. But a lot of persons who have actually used our treatment plan, who have used no stone capsules, they've reported. In fact, in the group, I'll be sharing amazing testimonies of people who have used our treatment plan and they are okay. So who have used no stone and they are okay. So you can also give it a trial and see how it actually helps you. So for now, you have seen that there are things that water cannot do, and there are things that surgery needs to be done. Okay, so you need to know what you are doing. So you can't have a 10 stone and a doctor is telling you to keep taking water, and you think that doctor is doing you good. That doctor is not doing you good. When you have a stone of 10 and above, you should know that what you need to do is surgery. So if at the end of this video, this is the knowledge I'm able to pass, I believe I have saved a lot of life. Then you also need surgery if you're having a PUJ obstruction. Okay, if you're having a PUJ obstruction, that means the stone is obstructing, is stuck at the PUJ. Okay, maybe the stone is very, very big that it can't come out. It means that you need to do operation to be able to bring it out. So the operation you're going to do could either be PCNL or the lesser literature you're talking about, or even open surgery, depending on how the severity. Sometimes this stone cell can even get stuck at the urinary bladder. So you need to also do surgery. If it's too big that it can't pass through urinary meatus, you can also do surgery in order to remove it. Because this is the point where if you don't do prompt intervention, the life of this person may actually become jeopardized. In fact, kidney stone, if not properly treated or not treated at all, can cause the kidneys to be damaged. And when kidneys are damaged, you know the cost of dialysis today. The cost of dialysis is now 50,000 naira per section, and the person stays in the dialysis machine for just 4 hours. Okay, that 4 hours a day, the person needs to repeat it 3 times in a week. So that 3 times in a week is 50,000 naira times 3. How much is it? 150,000 naira. And this person does this thing for 1 month, does it for a year, like does it for life. Imagine spending 150,000 on your health only and not on your food or any other thing that you need to survive. I know that we make money to be able to, the money serves as a shield for us, but if you're spending it on something you didn't bargain for, a health condition you would have prevented, it will cause you more serious concern. Okay, so that is it. And then if you say you're going for surgery, okay, kidney stone surgery is expensive too. Like we said, between 2 million to 10 million naira. Then if you said the kidney is bad now, you want to do kidney surgery, and that's kidney transplant. Kidney transplant is between 25 to 30 million naira. And after that, also you need to take post-transplant medications. That is another expenses altogether. So you need to be proactive about your health. do what you're supposed to do to make your health stand out, to make you fine. So I think with that we're going to be calling it an end to this program today. So if you've not gotten this book, once again, do well to get it. In fact, no stone capsule is available. Last week when we did our online class, I told us that it was not available, but now the no stone capsule is available, and we are delivering nationwide. And our delivery takes about a maximum of 5 to 7 days. So this is just the worst case scenario. It may actually come before that time. So if you have a question that you really want us to answer on this live section, you can just drop it. You can just drop it now. Okay. Okay. Nobody is asking any questions, so we'll take the questions in the group. Okay. So we'll be answering the questions in the group. In case you also have further questions to do, we can also answer it. All right. Thank you so much for being part of the class. Bye.